I'm going to go ahead and get started. I'm going to open up the April 21st, 2020 Select Board meeting. Now that we're doing our conferences on Zoom, I do have to read this script again. As a preliminary matter, this Select Board, as the Select Board Chair, permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Peter Carlson.
Peter Carlson here.
Doreen DeFazio.
Doreen DeFazio here.
Donna Stock.
Donna Stock here.
Ed Prisby.
Here.
Staff, when I call your name, please respond in the affirmative. Tim McInerney.
McInerney here.
Rebecca Meekins.
Rebecca Meekins here.
Anticipated speakers on the agenda, please respond in the affirmative. Karen Clark. Go ahead and unmute yourself, Karen.
You can tell I'm still new with this. I'm here. Thank you for having me tonight.
That's okay. Dr. Hirsch.
I'm here too.
All right, thank you. Good evening. This open meeting of the Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and to such, the governor's order suspend the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted on the town's website at www.grafton-ma.gov, allows public bodies to meet entirely remotely, so as long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting, it does not require public participation by law. There is no public hearing in this meeting. For this meeting, the Select Board is convening by Zoom as posted on the town's website, which identifies how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and that take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. We are now turning to the first item on the agenda, but before we do, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down a line of members, inviting each by name to provide any comment, questions, or motions. Please hold off until your name is called. Further, please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage with other members, please do so through the chair, taking care to identify yourself. After members have spoken, the chair will afford public comment as follows. The chair will first read public comments, questions received in advance of the meeting, followed by real-time board or applicant responses. Public comments during the meeting will be conducted through the Q&A feature in Zoom. The chair will read real-time comments, questions typed by computer participant in the Q&A feature, followed by real-time board applicant responses. Finally, each vote taken in this meeting will be conducted by roll call vote. All right, sorry, I have to read that every time, which is fine. The first thing on our agenda, I do have a couple quick announcements. Governor Baker has extended the closure of all schools through the remainder of the school year. In Grafton, that means remote learning will continue through June 12th. Schools have a lot more information on that. The brush dump will be open on Saturdays from 9 to 1. It is weather dependent. We ask that those using the brush dump adhere to the social distancing guidelines. We have received several questions about our annual Grafton Cleanup Day. As you can imagine, it's going to be a little difficult to do this year, but we will have bags available in the orange bin outside the municipal center starting this Friday. They will be bundled. We ask that you only take one bundle of bags as we have a limited number. When the bags are full, please call Kevin Gallagher at 839-8525 extension 1171 and leave a message with the location and nearest intersection. Thank you for participating in this program. We also have a number of residents who have been working hard to acknowledge, support, and help maintain the spirits of those working on the front lines during this pandemic. It's the actions of these people that make Grafton such a great town. We recently learned of 3 people and what they're doing to help in this crisis. Bill Yeomans and his wife Pat have purchased $10 gift cards and have been handing them out to Stop and Shop employees, people who come to work every day, and as Bill said, are stocking up, cleaning, and being helpful during a difficult time. Margaret Haynes created a small fundraiser on Facebook, raising $150 for Grafton Strong by making Bosox face masks. This money will be used to help individuals and families in Grafton affected by COVID-19. Pauline Wynn reached out to the town to see if there was a need for masks, and speaking with her, we learned that she has made over 1,000 masks for first responders, healthcare workers, and recently delivered 3 dozen to Stop and Shop for their employees. She's now making some for Crescent Manor Rest Home here in Grafton. So thank you, Bill, Pat, Margaret, and Pauline. If anybody else knows of anybody else that has been doing something to raise the spirits during the pandemic, please share the story with us. All right, we have no public comments this evening, and now we go to our first item. Welcome Karen Clark and Dr. Hirsch from the Worcester Regional Public Health Alliance to give us a coronavirus update. So I will turn the floor over to Karen and Dr. Hirsch.
Good evening, everybody. Actually, Dr. Hirsch, I think, was gonna sort of provide an overview of where things are in terms of the medical piece and any of the other items that he wants to sort of relay to the select board and also to the residents. So I'm gonna turn it over to Dr. Hirsch for right now, if that's okay.
Through the chair, thank you for letting us come, and we're grateful for all of Grafton's efforts in trying to mitigate against the spread of the virus. You know, I think as a community, we've learned so much about ourselves, about our grit and resilience in the people's homes, about the fantastic capabilities we have in our 2 large medical centers located in Worcester, about the ability of our medical school to stop on a dime and help us innovate and investigate the problem. The city manager of Worcester always uses this phrase. That's why I want to steal it, but I can't claim it for my own. He says, we're flying the plane, but we're building it while we're flying it. And it's kind of that way. We have been very, very fortunate in having so many partners come on board, and there have been a few parts that have fallen off in the flight, but we've been able to patch them together and keep the plane up in the air. So we're right now in the teeth of the surge. The 2 medical centers are at about 85% capacity in their ICUs and a similar capacity with their ventilators. We've been able to catch up quite a bit on the PPE issue in the hospital setting. We have been able to be very proactive in connecting the 2 hospitals together. I've been playing a small role with that. I do a coordinating call every Wednesday, so I will be doing one tomorrow trying to figure out where the two centers can help each other. The collaboration has been amazing because, one is a for-profit private institution, the other is a not-for-profit public institution, very different, not different missions, but certainly different models of organization. They've totally cooperated and totally collaborated, and it's made it so much easier on the emergency reception side of possible COVID positive patients, on the testing side, and also on the resource allocation side with PPE and ventilators. There's been total collaboration between the two centers. So a lot of that goes to the CEOs, Carolyn Jackson at St. Vincent's and Eric Dixon at UMass, for really dropping their affiliations at the door and just working together. We have been working very, very hard on our most vulnerable populations in the region. And I think one thing that has definitely attracted the attention of Beacon Hill has been, we are the only healthcare district in Massachusetts. And as such, we have the pleasure of dealing with your town board, also with the boards in Holden, Leicester, and Shrewsbury. And so when the 5 towns are united in saying we're having an issue, we're having a problem, I think it gives us a lot more strength and a lot more consolidation and coordination. And that's really why we're so happy that we could do these meetings like tonight. The surge, I think, is going to continue into next week. The projected peak date has been a little bit wobbly, but we're thinking it's the 27th or 28th now. So that would take us into the weekend. We're hoping then we would start to see both admissions go down and utilization in the ICU go down. Now, uniquely for Worcester, we have had 2 major pop-off valves to help keep the volume of patients at the 2 medical centers lower. And that is the Beaumont long-term care facility was converted into a COVID positive site that enables the healing COVID positive patient who's come through the ER, the ICU, and is getting better, or the patient that wasn't so severe that they needed ICU hospitalization and now just needs a time to recoup and end this 14-day period where we suggest that they might be infectious. Beaumont has been a great help to us. Similarly, the Army Corps of Engineers came, and you probably know, outfitted the DCU Center as a field hospital. And it had a 200-bed capacity. So far, we have not needed to use more than 20 at a time on the acute care side of the DCU. This past weekend, the DCU also opened a pod for homeless positive COVID people. And this has been a great help. The vulnerable populations that we are experiencing the most flashpoints with are obviously the elderly, because they have the much highest rate of mortality from being exposed to this virus. Then would come the homeless population. And then third would probably be our first responders. Fortunately, even though there are 140 combined healthcare workers at both UMass and St. Vincent's that have been tested positive for the virus, none of them have ended up in the inpatient ranks, and they've been able to actually get better, and many of them have gone back into the fray. And that's to their great credit. I don't think you can give enough credit to our medical providers, both pre-hospital and in the hospital, for the kind of dedication and expertise that they have been willing to bring to this problem, working incredibly long shifts, hard shifts, dangerous shifts, and still coming back for more every day with the same issues that all of you have as you're trying to figure out how to get through this crazy time. Childcare, how do I get groceries? How do I do the task of daily living? Do I bring this home to my family, or do I shelter here at the hospital? We have had a lot of different innovative solutions going. Our first and second year medical students are tutoring the children of our hospital staff now. They're also doing a lot of other tasks for us all through the city. We've been able to hook them up with our senior center, which is something I wanted to mention to you all. I know you have a very active senior center. We have a system called Elder Buddies, where medical students get hooked up with seniors that are no longer being able to come to the senior center. And they've been just calling them a couple of times a day to give them some human contact. Sometimes they will actually read them a newspaper or tell them a story, and sometimes it's just listening. And we've also used those students to help us with meal delivery as well. So if those are resources that you would like to tap into, please let us know. So getting back to the virus itself, what have we learned over this period of time, almost 5 weeks now of dealing with this in the hospital setting? It's a very pesky virus. It presents in various and sundry ways that we didn't expect based on what we were being told from Europe and from Asia. Not everybody presents with fevers. Not everybody presents with respiratory issues. There are many people that present with GI issues, because when the lower lung lobes are the affected area of the lung that COVID seems to like to be in, it causes inflammation of the diaphragm, that muscle that separates the chest from the belly, and will cause GI symptoms. So diarrhea, gastritis, severe heartburn, all of these things have been seen with presentation of the virus. You probably have heard that younger patients have also presented atypically with loss of sense of smell and sense of taste, but none of these other respiratory symptoms or fevers. And then the last thing that we are noticing now, we actually have a study group looking at our death certificates for the entire period of time that we're discussing. Patients are dying at home, and patients are dying in the hospital, not thought to have had COVID positive problems, but have come in with strokes, heart attacks, pulmonary emboli, phlebitis in the legs, deep vein thrombosis. We think that the virus causes some of these clotting abnormalities that make you clot more easily. And if you clot vessels in your brain, you're going to stroke. If you clot them in your heart, you're going to have a heart attack. If you clot them in your legs, they'll embolize into your chest. And we're seeing unusual presentations in unusual age groups of that. And we think this is going to end up being COVID related. So I guess the bottom line is, just like we're seeing as we go through some of these institutions outside of the hospital and test everyone there, we find enormous numbers of asymptomatic people that never thought they had the virus, but they have it. And that's why, in the end, it's the things that the citizens of Grafton and the citizens of Worcester County have done to really try to be vigilant about the social distancing, the hand sanitizing, the mask wearing, and just the sheltering in place as much as possible, that's made a huge difference, because many among us, probably myself, my family, I've been out and about throughout the city all the time. I may have it. I haven't been tested. I haven't felt symptomatic at all. I wear a mask. I try my best to follow all the things that I preach, but I know that many of us out there that feel great have this disease, and that's why it's so important not to let our foot up off the accelerator. We've got to keep it down until we start seeing the number of cases that are admitted to the hospital and the number of patients in the ICU diminish, until we get some better algorithms for testing to really see who had it, who didn't have it. I think the antibody test that is going to be rolled out probably in the early month of May is going to be a game changer, because we'll be able to see who had it recently, who had it a long time ago, who has antibodies, and who's like virginal to it. And that will help us know a lot more about who's got immunity and who doesn't, and who could go back into the fray. But what we don't know is how long is that immunity conferred for, and whether this is one of those viruses that's going to be back every year or even back every 6 months with a new strain. Is it going to mutate? Is it going to be one of those ones like the flu, where every year we have to guess on the best kind of strain that's coming out so we can design our vaccine each year? We don't know that. And the vaccine, unfortunately, is probably still a good 9 to 12 months away from being a reality. So we are testing some really interesting drugs, even at UMass. We're testing 2 antiviral drugs. One was designed for HIV and one was designed for Ebola, that are showing some promise. We're also testing the use of convalescent serum, where people who have been sick with the virus give us their plasma and we infuse it into very sick patients. And there's been some promise there, but it's not the kind of thing that I can say, bam, you should do this. The drugs that you've heard about, the hydrochloroquine drug, that the antimalarial, the Z-Pak, azithromycin drug that people commonly use for sinus infections, none of this has really had a clinical trial that makes it worthy of touting yet. There are trials going on all over the country, though, and I feel that within the next 3 months, we will have some better drug regimens for this. But that's where we have to really not let up too soon, because right now it's everything the community is doing. A lot of what the docs and the nurses and the respiratory therapists are doing, but it's blood, sweat, and tears. It's not drugs or vaccines. So I'll shut up because I can go on this all day. I really appreciate the opportunity of kind of getting you up to date. I can take any questions that you have. Karen is the brains of the outfit for sure, because she keeps all the balls in the air, all the towns, all the parts of our department. We have an emergency preparedness department. We have an epidemiologic department. We have a public nurse department. And we have this community health department. And everybody is working 18 hours a day. It's amazing. It's the best team I've ever been on. And I'm very grateful to have a part in it. So thanks.
Thank you, Dr. Hirsch. Does anybody have any questions for Dr. Hirsch before Karen Clark speaks? All right, I'll put it over to Karen then.
Great. Thank you again for having us. And Dr. Hirsch, you're my biggest cheerleader. Thank you for that. Kudos to you as well. So Dr. Hirsch has also been in the trenches with us, as has our city manager for the last 5 weeks now. We've been working 7 days a week, a lot of hours. as far as our staff of 25, I've reassigned everybody to help with this response. There's just so many moving parts and so much that needs to be done. So I just wanted to kind of highlight a few things specific to Grafton. So in terms of just communication, you can imagine there's a lot of information, rapid fire, that comes out of Mass DPH as well as the governor's office. I am the lead for our health district to participate in a COVID command center call that takes place twice a week. I also am on another call twice a week as a large city lead. And essentially all that information that I get in regards to, you know, guidance that's coming out, everything from, you know, non-essential businesses to, you know, do people wear a mask? Do they not wear a mask? What kind of mask do they wear? There's been so much information and so much guidance that changes literally on a daily basis, not only with CDC, but also here in the state. So I'm the liaison to get all of that information back to the communities in the Alliance. I've also been running point on getting emergency public health funding to the towns in the Alliance. Several weeks ago, I sent out a needs assessment. Actually, I think it was at the end of March. The days are kind of blending here, but and essentially, I believe Grafton will be receiving a $24,000 check next week, and that's based on supplies and other items that were identified that are needed to stand up public health infrastructure in Grafton and all of the communities in the Alliance, including the city. The city actually got its own contract, but what happened was the state is using the Alliance structure or health district structures for the lead agencies to produce award letters and to cut the checks. So that's what I've been working on as well. So again, I believe $24,000 was identified that should be coming forward next week. There is additional funds that are available if needed. This is very specific funding. It's not to be used to pay paid for fire or police overtime, but it can be for PPE. It can be for if you wanted to do a mailing to everybody in town, you know, printing, postage, trying to potentially give a stipend to volunteers that or others that want to do what Dr. Hirsch talked about, a buddy system, you know, checking in on your most vulnerable populations. But aside from all of this information that I've been sharing, one of the key functions that we've been providing to Grafton is public health nursing. And as you can imagine, with 3 public health nurses, it's very difficult to manage the volume of positive cases. Just to give you a sense of the numbers, I believe Worcester is up to about 1,300 approximately. Leicester has 21, Holden has 31, Grafton has 41, and Shrewsbury has 106. I suspect these numbers are actually going to go up. We learned this afternoon that there was some kind of a glitch in the statewide database that we get our cases in. It's called Maven. It's basically it's a surveillance system, and it's for communicable diseases. It's how we communicate to the state and they communicate to us. So our epidemiologist had to run some special reports because of this glitch that happened to the whole state. It wasn't just us. So I think that the numbers have been pretty low over the last 3 days. My hope was that we were on the other side of the curve, but unfortunately, I think it was an error in their system. So I'll be interested to see what tomorrow's numbers look like. So as I said, right now, Grafton has 41 cases. What's been happening primarily is, just so you can understand the process. So we have this Maven system, and there's only certain people that can access it, our 3 public health nurses. And essentially every day we have to go in. It is not totally user friendly. It's not like you hit a button and it's got a whole list of who's positive for that day. You have to go in through multiple screens. And essentially between our nurses and our epidemiologists, we've created a tracking sheet. So every day when there's a new case, I let Tim and the Board of Health office know. And then immediately following, we're required, I believe either through the governor's office or it might be through Mass DPH. For this situation, we have to provide addresses to the dispatch so that they can ensure if they get a call and it's flagged in their CAD system, that they are properly suiting up in PPE before they go over to that person's house should they call 911. So we make sure that they have that information. We don't provide any names. It's all HIPAA protected. We try to protect people's privacy as much as we can, at the same time trying to give out just enough information so people can understand sort of what the climate looks like in terms of how many positive cases there are in the town. I'm just going to stop there for a second, and I have a few other things to mention, but I just want to see if there were any questions. Okay.
I'm sorry, I was having trouble finding my unmute button, Karen. I have a quick question. Do you keep track of how many people are recovered from the?
Yeah, so we've been getting a lot of questions on that. Right now, we don't have, yes, we do know when people are coming off of quarantine, because what happens is once somebody gets identified as being positive, one of our nurses will contact the case, and there's a whole matrix of questions that they ask to actually determine when the onset of symptoms was. And that really helps us, sorry, the joy of being at home. So that really helps us determine, you know, where does that 14-day period kind of fall on the continuum. And so we also then follow up with any of their close contacts to make sure that they're, you know, quarantined, et cetera. So there's a lot of calls that happen. And the other piece is we have to get the temperatures from the individuals twice a day. And that's how we monitor them. So we're constantly talking with folks. So right now, because there's so many cases, and we do have a number of trained volunteers, medical people that we've brought on board to give us a hand. It took a little longer than we would have liked because this isn't for everyone. This is very different than different kinds of nursing. It's public health nursing, and there's a training that needs to happen, but also the Maven system is not particularly user friendly. It's difficult to use. So in order to really deepen our bench, we had to really take time to get people trained up. So we're hoping that when we sort of get on the other side of this, that we can go in either with our volunteers or when our nurses catch a break, because they've been working 7 days a week, like 14-hour days, that we can start removing people off of that address list that we're providing to dispatch, but also start talking about those stories about people who have recovered. It's more of a capacity issue right now. Right now, all of our efforts on just trying to contact people and make sure that they know how to isolate and quarantine appropriately. And also, like I said, each person is 2 phone calls a day. So you can imagine the amount of work, even with a team of volunteers, just to connect with all these people. Because we're talking 1,500 people. Like, it's a lot of work. So yes, we want to be able to tell that story because there are a lot of people who are recovering. But we need to figure out a way to do that and find the time to do it. So that'll hopefully be coming sooner rather than later.
Any other questions before Karen moved? Karen, did you have a couple other things you said?
Let me just look at what I had. Oh, in terms of volunteers, Tim had asked me if, and I know a lot of people want to help. So I know that Grafton has its own medical reserve corps, so obviously people can reach out there and get plugged in, and whether that's making phone calls to seniors, or if folks through the MRC or not through the MRC want to help out at the DCU field hospital. There's certainly a need. There's an urgent need for volunteers there. But also, one of the things that we're already starting to talk about, while we're trying to mitigate this and we're in the throes of this whole thing, we have to also start thinking about the recovery period, which is probably, as Dr. Hirsch said, 9 to probably 12 months out. If it's a pill or a vaccine or whatever it is, all our communities are going to have to start setting up emergency dispensing sites, which could be a drive-through situation. It could be, a school, but you're talking about mass vaccinating all of your population, in a 24 or 48 hour period. There's a lot of work and coordination that needs to go into that. And there's a lot of volunteers that are going to be needed. So, certainly if people want to help, but they're nervous about being out, since we're telling people to social distance, we're hoping on the other side of this that, people will help out when it does come time to give out a vaccine or some kind of a pill. And that'll be sometime next year, but there's going to be a lot of help needed there.
Any any questions for Karen? Thank you both for coming. It doesn't appear that there's any questions. I think, is that everything that you wanted to say, Karen? Yeah. All right. Thank you both for joining us tonight. Thank you for all your hard work. And thank you for helping keep our community safe. Thank you so much.
Thank you. Thank you.
Right. All right. Next on the agenda is we do not have any appointments this week. We have new business, vote to accept option to delay real estate and personal property tax to the due date to June 1st, 2020. Tim, did you want to set this up?
Sure. I think it was Peter who asked about these two particular state laws that can be enacted by the board and voted on. I did some analysis relative to the revenue reduction. There's probably between 5,000 and 7,500 that will not be captured. But as I reported last week or the week before, our revenues are exceeding ahead of pace, at least for right now. Certainly building permits, I think it was 18 months ago, the board voted to increase building permits from $7 per 1,000 of value to $10. And those have displayed extraordinary results in terms of our revenue and cash flow for fiscal 20. So there won't be an impact. We do carry some interest and penalties every year. But as you can imagine, if everybody paid, we wouldn't enjoy those monies. But you have the ability to offset and give some relief to those in need by adopting this. And there won't be a revenue impact or cash flow issue for us.
Thank you. Any questions? Do I have a motion?
Madam Chair, I
Mr.
move the board
Carlson?
vote to accept the option to delay the real estate and personal property tax due date to June 1st, 2020.
Second.
I have a motion and a second. Any discussion? Hearing none by roll call?
Carlson, aye.
Sorry, I couldn't find my mute button for a minute.
That's
DeFazio.
okay.
Thank you.
Frisbee, aye.
Thomas, aye. Motion is carried. Thank you. Next on the agenda is vote to accept the option to waive interest and penalties for late real estate and personal property tax payments for all payments received on or before June 29th, 2020. Tim?
It's really the same issue here. Yeah, you obviously extended the time, and now that they're extended, when they do pay, those penalties and interest would be waived. And again, the same cash flow situation that I spoke of earlier. You won't have a significant impact as a result of this. And again, 80% of our monies come from mortgage companies and lockbox, not individual payers. So the individual payers to take advantage of this will be extremely grateful for it, I'm sure.
Thank you. Any questions? Do I have a motion?
Madam Chair, I move the board vote to accept the option to waive interest and penalties for late real estate and personal property tax payments for all payments received on or before June 29, 2020.
Second.
I have a motion and a second. Any discussion? Hearing none by roll call?
Stock eye.
Carlson, aye.
Fazio, I.
Frisbee, aye.
Thomas, I. Motion is carried. Thank you. Next, we have vote to approve lease agreement with Select Energy for Millbury Street Elementary School roof.
So there was a memo from Dan that we included late in the packet that laid out the Millbury Street School solar project. They're renting the roof to Select Energy for a sum of money. I think it's $20,000 a year. So all of the SRECs and all of the energy it generates goes back to the grid, and the installation didn't cost the district any money, but they do receive a annual lease fee, which needs to be approved by the select board.
Any questions? I'm not seeing any questions. Do I have a motion?
Madam Chair, I move the board vote to approve the lease between Grafton Public Schools and Select Energy to enter into a lease for Select Energy to own and manage and maintain solar panels on the roof of Millbury Street Elementary School at the agreed upon rental payments over a lease of 20 years.
Second.
I have a motion and a second. Any discussion? Hearing none, all in favor by roll call?
Stock eye.
Carlson, aye.
Fazio, I.
Frisbee, aye.
Thomas, I. Motion is carried. Next, we have select board reports. Are there any select board reports?
Madam Chair, if I just want to add one thing, I want to thank Tim for going through the analysis and providing that for the local property tax relief. I asked him last week to put that on. But I just wanted to publicly thank him for his time and his input on the analysis on what that does to our receivables. I just want to say appreciate the work you put towards it. Thank you.
Any other select board reports? Otherwise, TA report.
Yes, thank you. Just a couple things. The cable license for Charter is up for renewal. We've been going through a process with them. Been a little slowed by this COVID-19 situation, but we do expect to have a draft renewal license for Charter from May 1st. And that expires. I can't disclose the tentative agreement we have now with the board, but it is, comparable to Verizon's, and it's certainly favorable to the town overall. But the agreement for the franchise agreement is set to expire in September 2020. So we want to get a draft agreement to you for May 1st. That's what the agreed upon deal was with Charter to do that, and then you'll be able to look at those terms ahead of any ratification that the board would have to do. So that has been worked on and underway. Any questions on that piece? All right.
Chair, one question.
Yes.
Tim, did we hold a public hearing on that license renewal as part of the relicensing process?
You had a ascertainment hearing. Oh, this is a long time ago now when we started the process. There's an informal negotiation process and there's a formal negotiation process. Because the terms of the deal were favorable, we didn't want to expend that extra money going through a formal process, but you did an ascertainment piece and you do an informal ratification of the new agreement with Charter. So you didn't go out to bid for those particulars, if you could find another vendor, for example, to replace Charter. You did not do that.
Thank you.
Tim, I have a question coming in through the Q&A. Justin Wood, 5 Garden Street. Will the town retain the Verizon agreement with our Charter agreement? I think I can answer that, but I'll let you answer it. Go ahead.
Revive? I don't know what you mean. It's two different contracts. One
Right.
expires at a different time. The Verizon contract will live until its expiration or renegotiation. The charter agreement expires September 2020, and that'll live for as long as that agreement is termed for.
Okay, so they're two separate agreements.
Correct.
Thank you. All right, sorry, go ahead.
And I've talked a lot at past 3 meetings about 8 Pine Street. We did send off the RFP responses to Mass Historical Commission and the Grafton Historical Commission as well for review and comment. Under the agreement we have with the state for the sales partnership agreement, we have to give them, I think it's 30 days to give comments on those proposals. And we cannot interview any of the applicants until those groups have offered comments if they choose to do so, but they do have, there's about 3 weeks left of their review process for their submissions or based on the submissions. So if we don't get anything by, I think I have it at May 11th, we can probably interview and or select the most advantageous proposer and start on a sales and purchase agreement for that parcel of 8 Pine. So I wanted to give you a quick update on that. The LED lights, I'll just tell you that if you wanted to see a map, we only had 28 fixtures installed with the new LED lights. We have 767 remaining to do. So we plan on doing, I think the goal is between 20 and 60 a day, depending on manpower from Tanco Electric. So it's only such a low number for completion, but it's 4%. So hopefully I can, post on Facebook or through my reporting that it's 4% as of Friday, and hopefully by next Tuesday it's 27%. It just exponentially grows from there in terms of the install of those lights. They did work today, and like I said, if people wanted to see the map, I could show the map to see what's been done to date. But they try to start in the center of town and work their way out. And it's good now because there's not a lot of traffic around town, so they can work safely to get those installed. So the Main Street project, I just want to update the board on this relative to from the Sutton line down to 122. The date is set for February 21st, 2021, so 10 months away, give or take. Work won't start until the fall of 2021. It takes 4 to 6 months for Mass DOT to finalize the terms of the deal with the contractors after advertising. So that's why there's kind of a delay from the February bid date to actual starting of work. But that's the best estimate right now. We are doing the final title searches now. The state has the plans, the layout plans for the right-of-way to VHB has done. And the appraiser we hired probably a month and a half ago or 2 months ago will have their final appraisals to DOT by the requisite deadline of September 1st. So those 3 components are working and ongoing, and we have constant contact with VHB, the state, and the appraisers to get the appraisals squared away now that we have the final layout of the right-of-way for the Main Street project. And then finally, 27 Upton Street is the old DPW site. We've done a lot of outreach and survey with the Horsley Whitney group. I will tell you that that was a mass development grant. They pay directly to Horsley Whitney to do all the data analysis and figuring out the highest and best use. They also agreed to do a wetlands delineation plan recently, so that not going to cost the town anything, but that'll become our plan, which will only help us when we go to put this property out on the market. So 2 pieces with that. One is we have a warrant article to declare it surplus land, and we can sell it with town meeting approval. And the second piece is part of the study we did with Horsley Whitney was determine its best use. Right now it's a residential 40-yard district, probably not the highest and best use given that it's a DPW site. So we're looking at mixed use and retail. Mixed use and retail got way more than 55% of the vote in terms of its highest and best reuse. So we had a conference call with ZBA Planning Select Board on March 5th to discuss that and ideas about how that would lay out. So we're asking the planning board, now that town meeting's been pushed back until June or perhaps later, to start look at hearings on the zone change with the public so we can move that forward on this warrant. So that's actually, when we get to that piece in the agenda, that's one additional piece on the agenda that wasn't there last week. But knowing that we could move town meeting back, we know we could take advantage of that timing and hopefully allow time for planning to have hearings on the zone change and put a meaningful article forward to town meeting to get that property rezoned, out to bid, and sold and repurposed and get it back on the tax rolls. That was the original goal when we determined that wasn't the best site for a DPW to live on. That's why they chose the other site. So that was that. Central Mass Mosquito Control Program, they are underway. They are working in the field, if you will. Spent several days in March cataloging wetlands, and they have a list of areas where treatment and larviciding have begun. Catch basin treatments will be better. Continue throughout the summer. That's a project that DPW should do in connection with the Board of Health that obviously Central Mass Mosquito Control will do. They had itineraries for education outreach to both the senior population and to education, but due to COVID-19, we're gonna have to be creative in terms of how we get the word out. Tire recycling or areas where source reduction is important. We have website links. We'll start to do some promotions around that. Tires that build up water or any place larvicide can breed, we want to get those tires out, and Mosquito Control Program will pick up those tires for free. So if people know that there's piles of tires someplace off the road that they've always seen, they can call the Mosquito Control Program. They can take a picture and see Click Fix and report that. They can call here. We just want all eyes and ears out to get rid of standing water so we can get rid of any mosquito breeding grounds. And then also their surveillance will begin in late May as well. This is where they put traps out, trap mosquitoes, and then test them for EEE. And obviously, if public officials, you on the Board of Health, decide that spraying is necessary in late June, August, July and August, you can make that decision at a later time, but it's available to the community. And I think it's actually available to individual residents as well if they had a problem with mosquitoes. So we'll roll out all the details on those programs over the next couple days. Obviously, we're focused on COVID, not EEE, but it's something we want to be aware of. Just one other note with EEE, the tick population is huge as well right now. It's big. It's going to be another issue for Lyme disease and tick bites. So people need to be aware of it and be careful of it too. So I'll just mention that now as it relates to mosquito control. And that is, that's all I have to report this evening.
Tim, we do have a question about the mosquito control. Can a property opt out of spraying? I'm sorry, the question's from Anne Marie Foley.
Opt out, well, it won't be like it was last year, right? Where we didn't have a choice, the state just did it. So they don't spray in any areas unless they're asked to by either the resident for their own residential parcel. So they wouldn't be opted in anyways, or if the board, there was a public health risk that was determined by the Board of Health, the Alliance, and Central Mass Mosquito Control, or even the state for that matter. So before they would do a mass spraying, and I think that was some of the misconception early on, that they just drove these trucks down the street and just sprayed everywhere. They don't do that. They do controlled spraying, and they do the things that I just talked about to mitigate the risk. So why they can't opt out, they were never opted in. So I'm trying to answer it, but it's not automatic that they're going to spray. That's made by elected officials and the Board of Health.
Okay. We have another question from Amy Marr, 36 Ferry Street. Does the CMMRC not also test for other mosquito-borne illnesses such as West Nile?
I'm sure they do. We were focused on EEE because that was our issue. I don't know what their other mitigation protocols are for testing are, but from my understanding is they do test for things that would be borne in mosquitoes. I don't think they test for malaria, but if it became an issue, they probably would. But EEE is where our big concern was last year, and I think that's why that's hypersensitive on everyone's mind.
Thank you. Are you, anything else in your report?
No, that's it.
Next on the agenda is correspondence, but we do not have any tonight. We'll give Peter a much-deserved break. Then first item under discussion, review draft annual and special town meeting warrant.
Okay, so under the special first, we did make some revisions. We put the correct time in there at the high school, June 20. We did take the next step to follow up with the school district, and we're fine for that date. So that resolved itself. The only addition on this one, Becca, there's 8 on here now. And I guess we ended with 8 Pine Street at the last meeting. So we're gonna put 27 in the annual town meeting warrant?
Correct. 27 is on the annual, yep.
All right, so any other adjustments to the special other than the date change?
That's correct.
All right, so if anyone has any questions or comments on the way those articles, again, we're not asking you to sign these tonight, you don't have to. We're looking at May 5th for a signature, provided nothing gets pushed back further. So,
Madam Chair,
Sorry, couldn't unmute.
Yeah.
Mr. Carlson.
not a problem. Is there any problem with signing the special one tonight? I mean, just to kind of get that out of the way. Do you foresee any reason why we need to wait until later on?
no, but the only risk is that something else comes up between now and May 4th that would cause the warrant to change and you have to re-sign it. We've always kind of signed them in tandem. Actually, you've always done the election, the annual, and the special all in one warrant, but this is a little different this year because of COVID. So I would recommend just holding off on the special until we do them both at the same time.
Any other questions on the special? Moving to the annual.
So Becca made some adjustments based on the recommendations that we had from the last meeting. We moved to Article 7. What is now Article 7 is the Grafton cable TV budget, which has to be voted on under the contingent budgets. And the other one, Becca, the other one was a submittal by citizens petition, and they are working on modifying that and getting requisite signatures from our last meeting when Ray advised us that it was not a, valid article. So pushing town meeting back certainly helped that process. Are there other pieces on here that I'm missing? I only remember 2, other than the date.
Well, I would ask the board to just take a look at the current ordering of the Super Park articles. Based on our last discussion last week, there was a request to move those around. I would just like to ask the board that the way they're ordered now is to the board's satisfaction. Obviously, if we do get a citizen's petition related to Super Park that comes in between now and May 6th, I assume that the board will have to talk about where it would like that article placed on the warrant.
So what number are they looking at now, just to make it easy on us? Is it?
Yeah, so beginning at Article 30.
Okay.
Did somebody have a question? Did I see a hand? I'm sorry.
I do, Madam Chair.
All right, go ahead.
So the article that was stricken was another one of the articles that would have affected, I guess, returning the money that we've already set aside for the Super Park, or on Article 30. There were 2 of them, now there's only 1 of them on here, right?
That's correct.
Okay, why was one stricken entirely? I remember a conversation about amending one. I didn't remember anything about striking it entirely.
Well, I think that was the thing we got from Ray was the article as it was written wouldn't be a valid article that town meeting could consider. So the applicant needed to resubmit a new article with amended signatures or amended document with the same signatures or some combination thereof.
Why was it invalid? Do we remember what Ray said?
There was one word or two words relative to the account, whether it's municipal capital stabilization account or capital stabilization account.
That seems a little bit harsh to make someone go get signatures again in the age of a pandemic because of one missing word, does it not? I mean, I've seen these articles amended on town floor.
I can only reiterate what Ray said. I don't want to get there and have it out of order. So I think that's why he called last week.
I mean, we don't have more than one capital stabilization fund. So it's like, if I say this money is going to go into the capital stabilization fund, it's not like you're going to say, well, which one? I mean, that it just seems kind of silly. Okay.
I did want to make a couple clarifying statements because we had some questions about CPC funding last week. And I did get some answers on that and so I just wanted to share the information I found. It is true, I said last week and I double checked, the amount cannot be changed on the floor in a CPC article. So if whatever the request is, that is the request. It has to be voted up or down. There's no altering the amount. Another thing to keep in mind, CPC funds may only augment municipal funds. They cannot replace existing funding. So in other words, CPA funds may not be appropriated to pay for a project cost that have already been appropriated from another source. So in this case, if the monies are removed by the citizens petition, that 241,000 will have to be replaced by some other funding source. CPC cannot be that funding source. So it could either be by another town funding source or donations or grants or something like that. So just to be clear, I know we had talked about it last week, that if that money is removed, it can't just be backfilled with CPA funds. The law doesn't work like that. That's against the law. So before the project really could move forward, another funding source would have to be found. So just to clarify, but because I had spoken about it last week about the order, I'm fine with the order. The citizen petitions can go first. I just would want to make sure that Recreation Commission, who submitted the CPC request, can speak before all of the articles, not wait until just the ones that they put forward through CPC. So those are my comments. So anything else on the warrant that you guys want to talk about?
Madam Chair,
Mr.
Yeah.
Felton?
just the commentary last week about the change in the bylaws for cannabis. Just where's the board? I know we wanted to talk about it this week, but it's not submitted by anyone. Town administrator did not want to apply the town administrator's office to that. So do we want to resolve that tonight and just say submitted by select board, or do we want to put it by the planning board, ask them if they would sponsor it? What's the pleasure of the board? I don't want this to kind of linger to the last minute. Give some direction.
Does anybody want to speak about that first? All right, I will. Pardon me. I'm not in favor of this article either. I mean, we've always taken a conservative approach to marijuana. When we first talked about it years ago, when it first was approved, we didn't want the whole town we wanted to be conservative in how many we allowed. We didn't want there to be one on every corner. And we still don't know how they're going to affect the community. We still don't know that impact because we don't have one open up yet. So I would like to wait until we have two opened up and see how they're running before we add more to town. So just to be clear, because I know this is going to get spun in a different way, I have signed every host agreement that I've been presented with. I am not against marijuana, but I am for a conservative approach, and I want to see how it goes before we add more stores. Donna, I saw your hand up.
Any comments that I made would mirror what you've already said. So I think 2 licenses is perfectly adequate for our community at this particular time.
Any other comments, questions? Okay,
So that leaves us with the question, what are we going to do with this? Is someone actually submitting it or what?
what do you suggest?
Well, I don't know. I mean, do we need to take a vote on it here? Or, I mean, if we're not doing this, we got to let people know we're not doing this. Somebody else might want to do it before May 6th. And this is the last time we're meeting before May 5th. So let's provide some leadership and say yes or no.
Okay, I'll take a motion.
So Madam Chair, just to reiterate, so Tim put the warrant language together, but didn't want to associate himself with it. But I think it's important that we seriously consider, the board seriously consider this, putting this in front of the town, because a lot of Tim's projections going forward is dependent on this line of business in Grafton to be able to produce some revenues. So I would like to make a motion that the select board sponsor Article 19, amend Article 39 of the general bylaws.
Second.
Okay, I have a motion and a second. Any discussion?
Yeah, Madam Chair.
Yes,
So as to the purpose of why I'm putting this on the warrant, is I want the town to basically tell us what it wants to do. If it's interested in seeing these projections of Mr. McInerney's come to fruition, then I really want them to consider, how do you get from point A to point B in a faster time in the best way possible? So I'm really hoping that, I'm not saying that, by us submitting it, we're in full support of passing this article tonight by the select board, but I'm encouraging my fellow members to vote in favor of putting this warrant article on here tonight to let the town make that decision on its own behalf. Thank you.
Mr. Prisby?
Yeah, and also, again, the economic news just keeps getting worse. We're looking at probably a longer economic impact from COVID than we possibly thought even a couple of weeks ago. We're looking at less revenue from the state going forward. We're looking at now, even though it's a few $1,000s, possibly a decrease in collections. And every dime counts. And I know that, we've had some, at times, heated arguments about projections in this room and how much we could expect out of recreational marijuana sales. Certainly, those numbers are less than they were before. And we have multiple applicants, in fact, more applicants for the spots for this than we have right now, who still seem to believe that their shops are all viable. And I guess I'm enough of an economic libertarian to say, okay, if you want to put your money where your mouth is and go develop a store, put the money into it, get the funding, if it succeeds, good for you. If it doesn't, then better luck next time. And just echo what Mr. Carlson said. Yeah, let's let the voters decide what they want in their town, to the extent that this is one of the few businesses where you can do that. Generally speaking, we don't do that. Generally speaking, the town gets out of the way of business. And each and every one of us here has run on the platform of economic development. So if we have somebody who wants to go develop a store and the store is legal, then let's get out of the way.
Donna, did I see it? Donna?
The last time this came up, which was several months ago, I was concerned about doing something at that point when we hadn't even opened an establishment. So during the past few months while I was campaigning, there's a lot of concerns about what the impact of a marijuana shop would have here. There was concerns about the exposure to young children and a lot of other things. So, I think there's a lot out there, and we're going to have a very different town meeting, I imagine, this time around. We're changing the date. We're also maybe in the throes of the residual of COVID, hopefully, not having it continue to spike. So I don't know what kind of turnout we're going to have. I don't think this is the right time to be expanding something that we haven't even, seen come to fruition yet. We don't know what the results are going to be. And as I said, I think 2 establishments for our community, which is a small local community, I prefer to pursue economic development in other arenas.
Doreen?
Sorry about that. I'm having problems with my mute button tonight. Can you hear me? Good. Okay. Yeah. So I I hear both sides and I agree with Jen and Donna on this. I'm not anti-marijuana either, but before we know what the impact of the town is going to be, and the fact that I don't support the article. And so I understand, Mr. Carlson's opinion of having this go out to a vote, but in this particular time when, like Donna had mentioned, very few people may show up at town meeting, and a majority of the board, it sounds like, doesn't support the article. I'm not against maybe giving the planning board an opportunity if there's a majority that it wants to go to a vote, fine. But since I don't personally support the article, I'm not going to vote yes on this.
Any further discussion? Okay, hearing none, all in favor by roll call?
Carlson, aye.
Frisbee, aye.
DeFazio, nay.
Stock, nay.
Thomas, nay. Motion has been defeated. Is there any other discussion on the annual warrant?
Becca, Madam Chair, just Becca, since you controlled this document up until, I don't know, yesterday, any other things the board should pay attention to on the ordering or any other changes we made? Besides 27 Upton, I don't even know what number that made it to.
So 27 Upton is Article 20. Nothing besides what we've already talked about has been added or moved around. Article 21 and 22, which are the 93 North Street article and the Lottie Drive Tim talked about last week, we're still waiting to hear back from Ginny and from Conservation and Recreation on 93 North Street. So we'll have more on that probably for the 5th.
So could I just as a reminder to the board, if 19, I guess we'd want to change the zone. Well, I guess it doesn't matter. If we're going to change the zone, it's going to happen someplace on this article, in this warrant. So it'll either directly before or directly after people might want to know what it's zoned before they vote to dispose of it. So probably before is my off the cuff guess right now. If what I'm thinking out loud here is if planning gets through their process and they have hearings and they do a zone change, the zone change would be in this warrant preceding the article to sell it. So it'll either be 19 or 21, depending on the numbering of the article. But it's not in here now because we kind of made that decision Friday to get it to planning when we had a conference call with Chris and Horse and Whitney to see if we could expedite that time frame to get it on this town meeting warrant in June. So, and there's two pieces to that, right? One is there'll be an article to change the zone to get the highest and best dollar figure to resell it and reuse it. And that has to happen. And I think it should happen before the disposal of the property vote happens.
If I could just add one more quick thing. Earlier we were discussing the potential date for signing of the warrant, and I think Tim may have said May 5th. I just want to clarify that it likely won't happen until May 12th because the warrant doesn't officially close for citizens petitions until the end of day on the 6th. So we do need to give those folks until the end of day on the 6th to submit anything. And then, so the board will have an opportunity to review the warrant one more time on the 5th. And then the following week on the 12th, we'll likely ask the board to sign.
My apologies.
Tim, I do have a question that I don't understand, but maybe you do, from Justin Wood, 5 Garden Street, for warrant article discussion. Whatever came about the RFP for 7 Institute rear, did any bids come in? Why is it not part of the warrant for
We
the
haven't
town?
put it back out on the street yet.
Okay,
Just not a huge priority, so we hope to bring it to October town meeting. No, it's a huge priority, just not in light of everything else that's going on. So I don't want to diminish it, but It's town's property. It can't be developed without, your approval and town meeting's approval, so.
Okay.
So I don't, do you want me to, Becca and I could pin that down right now so we can get a commitment and the community will know if it's that important to the board.
For what are you gonna get?
We can work backwards to figure out the timing of the release of the invitation for bid for that parcel, if you wanted to do that right now.
We can discuss at the next meeting if it's not.
Okay,
You can include it in your TA report next time if you're doing work on it.
all right. We can work on the timeline.
Okay. Any other questions? I see there's some stuff coming through chat. Again, if everybody can use the Q&A, I'm not monitoring chat. I'm only monitoring Q&A. So, oh, Mr. Carlson?
Yeah, I'm just reminding people of that to use the Q&A section of Zoom meeting. Yes, if you please would like to address the chair, please use that Q&A section at the bottom of the Zoom meeting app. Thank you.
Thanks, Peter. Any other questions about the warrant? All right, we'll move on to fiscal year 21 budget discussion.
Okay, so last week we talked about our main goal to get kind of agreement around the main philosophies. If we asked the community for an override vote and it were to fail, we needed a backup plan relative to that. And what compounded that was revenue estimates from our increases dropping in fiscal 21. So Becca put together this spreadsheet that was pretty, not a spreadsheet, but a PowerPoint presentation. It was pretty easy to follow along. So at the end of this, we can go through the whole thing. I just need to get some agreement from the board on the direction and use of one-time monies inside of warrant articles and budget reductions and, possibly bag fee increases, which no one likes, and or a combination of using more from stabilization. Obviously, with the commitment of replenishing stabilization upon the sale of 8 Pine Street, which will more than adequately replenish any monies we're proposing to use for fiscal 21. So I don't know, Becca, you want to bring that up, or does the board read it? Do you have questions? We can just jump right off from the questions you may have.
Does anybody have any questions? Donna?
Yeah, I see that you've proposed the 25% increase in the bag fee. And I thought we had some question on whether or not we could, instead of using that vehicle to take that $50,000 that may come from that, and use stabilization free cash to cover that expense.
Yeah, you did have discussion on it, and that's why we kind of put it on there as an option. I mean, I'm open to it. I just need to get agreement. I want the board to be in agreement with the broad concepts here. So if you wanted me to change that from increasing bag fees to use stabilization, the difference, Becca, can you just tell us what the difference is of stabilization and or free cash versus revenue?
Yeah, sure. If the chair is okay with it, if I could share my screen, it just might be easier for folks to follow along.
Sure, that's great.
Okay. Can everyone see the
Yes.
Okay, perfect. So this sheet here that I'm looking at, post-COVID-19 revenues and expenses. So this is sort of a breakdown of everything. If you look at this surplus shortfall line, so if the board chose not to make any changes to the bag fees for FY21, and accepted the cuts that Tim has proposed in this presentation, we would still be short $190,721. If the board chose to move forward with increasing the bag fee, that would increase revenues by $50,000, which would mean the new shortfall was $140,721. So it's a $50,000 swing either way. And obviously, there's the option of stabilization and or free cash to shore up that shortfall in FY21. And if we were to use stabilization, Tim and I discussed a commitment to replace those funds at the first opportunity.
I guess I would just reiterate, I think we heard it loud and clear from the seniors that attended our forum at the senior center that this is one thing that they would prefer not to have as an increase on their limited income or fixed income costs.
Doreen?
So I would go for
Oh.
adding it to the 190,000.
Okay, thank you. Doreen? No?
No, sorry. I don't
That's okay.
know why my audio keeps disappearing tonight. My apologies. So yeah, I would like to not have bag fees extended either. And I just, Becca, you just mentioned a commitment to replace funds, it says on the bottom of the screen, with the sale of 8 Pine Street proceeds. So that would be with or without that increased revenue from the bags, correct? So we'd be,
Number, if it's 190 or 140, we would replace either one with 8 Pine Street sales. Sorry, Becca, if I talked over you, I apologize.
thank you. That's what I wanted to know. So I'm in favor of that, using the additional stabilization free cash and not increasing the revenue from the bags, just to clarify. Thank you.
Okay. Becca, we do have a question about the bag fee. Tell me the delta and difference between bag fees and stickers, and one of your pages of your presentation has that good information. So I just wanted to call that. I think that answers the question, what the current fees are and how much revenue we get from them. So currently they're $9 per large roll and $5 per small roll. Currently we get $500,000 from bag fees. If this proposal increases them up to 25%, up from 25% to 11.25 per roll for the big ones, and the small ones 6.25 per roll, which would yield an additional $50,000 in revenue, which also takes into account the increase in manufacturing costs. So I hope that answers that question. There are a couple other questions, but they're not quite pertinent. Does anybody else, Becca, if you are done, if everybody's done looking at that, if you can stop sharing the screen. I just have a hard time seeing everybody, so I can't really see if anybody, thank you, has another question.
Yeah, Madam Chair, thank you. Just on, I'm not in favor of extending or increasing the bag fees myself either. Let's see what we can do with the Pine Street sale. I'm not in favor of using one-time funding to back end to our operational budget, but I think given the situation that's at hand here, I think, the idea of using stabilizations for a rainy day, and it's pouring out right now. I've used that before. So I would like to wait and see if we have to, if we had to raise bag fees for whatever reason, what would be the absolute latest we would have to do so to have any real effect on our budget, if it was something we absolutely had to do. Can you answer that, Becca?
It's probably June is the latest, because there'll be a lag in terms of updating the barcode that they scan at the supermarket. But, people buy bags every, there's probably a spike in bag sales now as a result of us even talking about it. So these are all estimates based on, the 8 years of production and sales. So by June would be the best guess to make a decision by the end of June.
Thank you.
Ed?
Yeah, I'm really not in favor of using stabilization either, though, and not to contradict you, Peter, but it's not even raining yet. As a result of this crisis right now, we might have to defer collecting some revenue, and it's only going to amount to maybe the 5 figures next year, if this goes on, we really could be in the middle of something. And at that point, we might have to resort to leaning on stabilization if we haven't passed an override by then. So it's not so much right now that scares me. It's upcoming. It's a year from now. You know what I'm saying? So if we could avoid it, I'd like to, because I get the impression that it could very well be we're leaning on stabilization even harder next year. And we're going to get to the point, percentage-wise of the budget, where it could potentially start affecting our bond rating. I wonder if we've considered at all the impact of closing the municipal center 1 day a week. I know some towns have gone to Fridays being closed as a cost saver.
Well, if it's for me, no, we haven't considered it. We'd save money in utilities. I'd have to negotiate the reduced time for the hourly employees who work here in the union context. I think they're at 32 and a half hours now. So to lose that extra day would be painful. But from a cost perspective, it's certainly something that we may have to look at, but I'm not looking at it at this time. But there's no real utility costs. Everything's LED. We're on natural gas. We have solar on the roof. You know, those costs of we put them clearly in a box where it's very inexpensive to run this facility on a day-to-day basis. It's all labor costs.
Okay. I'm also for waiting on the bag fees. I mean, if we do find ourselves in a position that we need to raise them at a later date, we can. So it's not like this option is going to go away if we don't do it now. Sorry, I'm just trying to figure out, there's comments on question and answer. I'm trying to figure out. I'm not sure. We have a question from Colleen Roy, 53 Elmwood Street. At the TRICOM, the TA recommended using 131,599 from stabilization and collecting 50 in revenue from bag fees for a total of 181,599. Now the recommendation is to use 197,21 from stabilization. Where did the additional 10,000 come from? I think in Becca's presentation that is online, it shows where all that stuff came from.
Yeah, just for clarification, Becca, you can go over those adjustments to expenses that we had to make.
Would you like me to go? You'd like me to go through line by line? The answer to the question is that the adjustments were just modified a tiny bit since then to now, but I can walk through line by line if the board would like me to.
I don't think that's necessary.
Okay.
All right. Does anybody have any other questions or comments on the budget fiscal year 21? Does everybody? Oh, Peter, I see your mouth moving.
Yeah, I just say, Madam Chair, not at this time. This will be brought up again at the next meeting. I'm sure this will be on the agenda item. You think that'll be right?
Yeah, I mean, FY21 until we get to town meeting will be on there. I mean, we were, barring more information that leads us to believe revenues or expenses change significantly, we won't talk in this level of detail relative to 21. So the last slide, the reason why we had it back on the agenda was to get coalescence around the revenue adjustments that we're anticipating from what we had increased before pre-COVID, and then agreement on expense reductions, the laundry list and presentation. And then, if the proposed budget is balanced now without the override were to fail, what do we do when we present you with these options? And None of them are good. I mean, we all know that. None of these options are good. It's just what we're faced with. And I'd rather have that discussion now than going down the road, spend as if, and then not collect the revenue, then we have to make deeper cuts halfway through or, you know, a third of the way into a fiscal year.
All right, are we ready to move on then? Okay, meeting minutes. Do I have a,
Chair,
yes, Donna,
I move that we approve the meeting minutes dated March 17th, 2020 as presented.
do I have a second?
Second,
Second.
Any discussion? Hearing none, all in favor by roll call?
Stock eye.
Carlson, I.
DeFazio, aye.
Frisbee, aye.
Thomas, I. Motion is carried. Minutes from April 7th, 2020.
Madam Chair, I move that we approve the meeting minutes from April 7th, 2020 as presented.
Do I have a second? I have a motion and a second. Any discussion? Hearing none, all in favor?
Stock
Carlson,
eye.
I.
DeFazio, aye.
Frisbee, aye.
Thomas, I. Motion has carried. All right.
Motion to adjourn.
Second,
I have a motion to adjourn. Any, all right, all in
Carlson, I.
favor by roll call?
Stock eye.
Frisbee, aye.
Thomas, I. All
Good night,
right, thank you very much, everybody. Good night.